Good morning, good afternoon, and good evening. My name is Hafiz Mukhtar Jawan. You are welcome to Weekly Healthy Tips, and today we are going to discuss about arthritis. Arthritis is common but not well understood. Actually, arthritis is not a single disease. It is an informal way of referring to joint pain or joint disease. It is most common among women and occurs more frequently as people get older. Common arthritis joint symptoms include pain, swelling, stiffness, decreased range of motion. Some symptoms may come and go away, and it can be mild, moderate, or severe, and it may stay for some years, and it may progress or get worse over time. Severe arthritis can result in chronic pain, inability to do daily activities, and difficult to walk or climb stairs. Arthritis can cause permanent joint changes. These changes can be visible, such as snubby finger, but obtained the damage can only be seen on an X-ray. Some types of arthritis also affect heart, eyes, and lungs. There are over 100 types of diseases which bear the name arthritis. Some of them are degenerative arthritis, inflammatory arthritis, metabolic arthritis, infectious arthritis, and many more. An example of common degenerative arthritis is osteoarthritis. It is the most common type of arthritis whereby the cartilage, that is the silic, cushioning the surface of joint bones, wears away. Bone rubs against each other, causing pain, swelling, and stiffness. And over time, joint can lose strength and pain may become chronic. The risk factors of this osteoarthritis include excess weight, family history, age, and previous injury, such as ligament injury, for example in knee. It might be ACL, anterior cruciate ligament tear. When the joint symptoms of arthritis are mild or moderate, they can be managed by doing the following: balancing activity with rest, don't stress yourself, using hot and cold therapies, regular physical activity, maintaining healthy weight, strengthening the muscles around the joint for added support, using assistive device, and taking OTC pain relievers or anti-inflammatory medicines, and avoiding excessive repetitive movement. If joint symptoms are severe, causing limited mobility and affecting quality of life, some of the above management that I mentioned may be helpful, but joint replacement may be necessary. Osteoarthritis can be prevented by staying active, maintaining a healthy weight, and avoiding injury and repetitive movement. Second one, inflammatory arthritis. A healthy immune system is protective. It is the protective mechanism in the body. It generates internal inflammation to get rid of infection and prevent disease. But the immune system can go awry, mistakenly attacking the joint with uncontrolled inflammation, potentially causing joint erosion and may damage internal organs, such as eyes and other part of the body. And the most And the most common inflammatory arthritis is rheumatoid arthritis and psoriatic arthritis. Researchers believe that combination of genetic and environmental factors can trigger autoimmunity, thereby causing the immune system to mistakenly attack the internal organs of the body. And another risk factor is smoking. Smoking is an example of environmental risk factor that can trigger rheumatoid arthritis in people with certain genes. With autoimmune and inflammatory types of arthritis, early diagnosis and aggressive treatment is critical. Slowing disease activity can help minimize or even prevent permanent joint damage. Remission is the goal and may be achieved through the use of one or more medications known as disease-modifying anti-rheumatic drugs, DMARDs. And the goal of treatment is to reduce pain, improve function, and prevent further joint damage. The third most common is infectious arthritis. A bacterium, virus, or fungus can enter joint and trigger inflammation. Examples of organisms that can impact joint are Salmonella, Shigella from food poisoning or contamination, Chlamydia and gonorrhea, sexually transmitted diseases, and hepatitis C, a blood infection obtained through shared needles or transfusions. In many cases, timely treatment with antibiotics may clear the joint infection, but sometimes arthritis becomes chronic, that is infectious arthritis. Another one is metabolic arthritis. Uric acid is formed as the body breaks down purines, a substance found in human cells and in many foods. Some people have high levels of uric acid because they naturally produce more than is needed, or the body can't get rid of the uric acid quickly enough. In some people, the uric acid builds up and forms needle-like crystals in the joint, resulting in sudden spikes of extreme joint pain or a gout attack. Gout can come and go in an episode, or if uric acid levels aren't produced, it can become chronic, causing ongoing pain and disability. And here are some symptoms of arthritis: inability to use the hand or walk, stiffness, which may be worse in the morning or after use, malaise or fatigue, weight loss, poor sleep, muscle aches and pain, tenderness, difficulty moving the joint, muscle weaknesses, loss of flexibility, and decreased aerobic fitness. Of course, there are some risk factors that might predispose to arthritis. These risk factors can be modifiable and can be non-modifiable. The non-modifiable risk factors are age, gender. The non-modifiable risk factors are age, gender, and genetic. Let's talk about age. The risk of developing most types of arthritis can increase with age, obviously. And gender. Most types of arthritis are more common in women, as I stated earlier, and 52% of all adults with arthritis are women. Gout is more common in men. And genetic. Specific genes are associated with high risk of certain types of arthritis, such as rheumatoid arthritis, systemic lupus erythematosus, SLE, and ankylosing spondylitis. While the non-modifiable risk factors are modifiable risk factors, meaning those factors that you can modify them: overweight and obesity, joint injuries, infection, occupation, diet, smoking, etc. Overweight and obesity. Excess weight can contribute to both the onset and progression of osteoarthritis. because it is increased. Let's take an example of a knee joint. It's increasing the overload on your knee joints, thereby increasing the effect on the cartilage that is cushioning the joint surface. Joint injuries. And jamming to joint can contribute to the development of osteoarthritis in that joint. Infection and many microbial agents can impact joint and potentially cause development of various forms of arthritis. Occupation. Certain occupations involving repetitive knee bending and squatting are associated with osteoarthritis of knee. Diet. It plays a major role in weight maintenance, a key factor in reduction and the prevention of disease progression. Diet is also an identified risk factor for the development of gout and its management. For instance, diet rich in high concentration of sodium salt are risk factor for the development of rheumatoid arthritis. Smoking. Smoking has also been one of the habits that have been implicated with the contribution of severity of the arthritis. Lots of clinical studies now indicate that cigarette smoking has a big role to play in progression of rheumatoid arthritis if the genetic climate is right. Currently, scientists are trying to have an understanding of how smoking could trigger particularly an aggressive form of rheumatoid arthritis in some people. And the other risk factor is particularly for women, that is those who used to wear high heels. When wearing a high heels, women increase loading or pressure across their knee in a way that might increase the knee arthritis, says rheumatologist David Pelson, MD, MPH, a professor of medicine and epidemiology at Boston University School of Medicine. Let's look at some of the habits that can decrease arthritis pain. Number 1, control weight. Your knee may be responding directly to the weight gain. Being overweight or obese means your joint must carry a greater load, and this causes the wear and tear that characterize the osteoarthritis. If you want arthritis pain relief, losing even 10 pounds is essential. Second, physical activity. Pushing yourself too hard put you at risk for joint injury and increase joint pain. So you should be active, but stick to a moderate pace and try to build a variety of activities into your life. Gentle exercise can delay the onset of arthritis even in people with strong genetic predisposition for it, and can help you stay mobile after arthritis sets in. Healthy fats. Omega-3 fatty acid can play a role in arthritis pain relief, says rheumatologist Bonita S. Liban, MD, an associate professor of rheumatology and clinical immunology at the University of Vermont in Burlington. These fats have an inflammatory properties similar to non-steroidal anti-inflammatory drugs, that is NSAIDs. You need fairly high daily dose of 2,000 to 3,000 milligrams to achieve pain relief. Take supplement and try eat foods such as salmon that contain these healthy fats naturally. Make sure you tell your doctor about this and any other supplement that you are taking. Another one, get more vitamin D. You may not consciously be avoiding vitamin D, but if you religiously wear sunblock and tend not to eat eggs or sardines like an Indian, you probably don't get enough of this essential vitamin. Preliminary research suggests that if you don't get enough vitamin D, which plays a key role in keeping bones healthy, you are at a greater risk for joint pain and arthritis. Consider taking a supplement as well as amping up the vitamin D food sources in your diet. Another one, get good sleep. Lack of sleep and arthritis pain combine to create a vicious cycle. Studies shows that people who haven't had enough sleep the night before are more likely to report all kinds of pain, including joint pain, the next day. Unfortunately, for many people with arthritis, sleep is challenging because joint pain wakes them up. Nonetheless, sleep is important. Talk to your doctor about arthritis control that can help you sleep better and stamp out of stress. This is another way that can decrease arthritis pain. The problem is that stress can make your arthritis pain worse. Many people with joint pain feel their pain more deeply because their muscles tense up and protect the joint. If you are stressed, your overall physical tension can be greater, magnifying joint and muscle pain. So just take a deep breath and try to let all the stress go. Meditation, MFR, and acupuncture are all good options to relieve arthritis pain. So here comes to the end of brief discussion about arthritis pain and some possible ways that can decrease the pain. Don't forget, after watching this video, to share, likes, and subscribe to my channel if you didn't. I remain Hafiz Mukhtar Jahun. Thank you. See you again.